Welcome to another deep dive. Today we're going to be talking about focusing-oriented art therapy. It sounds kind of complicated, but basically we're going to be talking about how we can use art to understand those feelings we get in our bodies.
And this combination is so interesting because it uses both our mind and our body to help us grow and to heal.
Exactly. And we're using Laury Rappaport's book, Focusing-Oriented Art Therapy, to help us understand all of this. So today we want to look at what this book says about how focusing and art therapy can work together. We want to show you how this can help you understand your body and use art to help you heal and grow. Sort of like giving you a shortcut. Now, to really understand this, we need to take a look back at the origins of focusing and art therapy.
Yeah, you're right. Let's start there. To see how these two things work together, we need to look at where they came from individually. Focusing, which I'm sure a lot of you are familiar with, was developed by Eugene Gendlin. It's all about listening to your body and understanding what it's telling you, that felt sense.
Right. And art therapy's history is a bit longer and twistier. It began in the early to mid 20th century.
Yes, it came about through a lot of different ideas in psychology, like psychodynamic approaches from Freud, Jungian concepts about the unconscious mind, and even just looking at how children make art and what it tells us about them growing up.
It's really interesting how Dr. Rappaport saw that focusing and art therapy could be combined. It wasn't an obvious match, was it?
What Dr. Rappaport saw was how powerful images can be. Art gives us this visual language that can show what Gendlin calls the felt sense. Art lets us express those feelings that we don't have words for, those pre-verbal or nonverbal feelings.
And art therapy itself has a really interesting history. I remember reading about how it was used early on in mental institutions.
Yes, that's an important part of its history. It was used as a way to reach patients who couldn't really communicate with words. Like if you go back to the early 1800s, Painel talked about some patients who would draw and paint.
So it was a way to help people deal with really difficult emotions and experiences.
Yes, people like John Haslam, W.A.F. Brown, and Lombroso, they all wrote about the art made by people struggling with mental illness. The way they looked at this art is interesting. At first, they were using it to diagnose patients, trying to figure out what was wrong with them through their art. But then people like Marcel Reja, the pseudonym of Paul Meunier, and the Swiss psychiatrist Morgenthaler started looking at the art on its own. They saw it as beautiful and meaningful, separate from any diagnoses.
So as the art world changed, it started to influence how people saw this art, how they saw this exploration of what was going on inside people.
Yes, exactly. Just as psychology was getting more interested in the unconscious mind, artists were also moving away from just painting what they saw in the real world. They were interested in the art of different cultures, the art made by children, and the art of people who were considered mad at the time. For example, Prinzhorn's book had a big impact on the art world, and it came out at the same time as movements like Cubism and Surrealism. And of course, Dubuffet is the one who came up with the term art brut or outsider art. He saw the artistic value in the art made by people outside of the mainstream art world, outside of those fancy art schools.
Wow, that's fascinating. So many different things all coming together. And then you have people who really help to establish art therapy as its own field.
That's right. We have people like Margaret Naumburg, who was really influenced by Freud. She believed that making art could help people understand their unconscious thoughts and feelings. And then we have Rhoda Kellogg and Victor Lowenfeld, who are interested in how children's art changes as they get older. And Mary Huntoon at the Menninger Clinic, Jeannie Ryan with Gestalt Art Therapy, Hannah Yaxakwitkowska, one of the first people to do family art therapy. So many important people. There's Eleanor Ullman, Arthur Robbins, Myra Levick, and of course Sean McNiff, who believe that all of the arts, not just visual art, are connected. Each one of these people, they all had different ideas about art therapy, but together they helped to create this amazing and diverse field. So you see, what started out as a way to help people with really serious mental illness became something more. People started to see that art is beautiful and meaningful in itself. That shift really helped to open the door for art therapy to be combined with things like focusing, which looks at how our body feels.
Okay, so we have a better idea about the history now. Let's talk about focusing. What exactly is this felt sense?
So the felt sense is really important to understand focusing. Gendlin said it's like a whole body awareness of how you feel in a situation. Maybe you have a problem or you're just aware of how you feel in this moment. It's not just one feeling or thought. It's everything together, your mind, your body, maybe even your spirit. Have you ever had a gut feeling about something, even before you could explain why?
So it's like more than just saying, I feel sad. It's like this bigger feeling that's hard to explain.
Yeah, exactly. It's that place where your conscious mind and unconscious mind kind of meet. It's
Yeah.
like your body's trying to tell you something but doesn't use words. Another interesting thing is research shows that people who do well in therapy are often what we call higher experiencers, people who naturally pay attention to what their body's telling them.
What if you're not that good at paying attention to your body? What if you're not a higher experiencer?
Well, that's okay. Studies have shown that learning focusing can actually help you become a higher experiencer. It helps you learn to listen to your body better, and that might help you get more out of therapy and personal growth.
That's good to know. So how do we learn to listen to that felt sense? Is there a special way to do it?
It's not really about a technique. It's more about how you treat yourself. We'll call the focusing attitude. It means being kind, accepting, not judging yourself, being friendly to whatever feelings come up.
Friendly to your feelings. I like that. It sounds a lot nicer than just saying accept your feelings, especially if those feelings are hard.
That's a really good point. Ann Weiser Cornell, she even talks about saying hello to the feeling, like you're greeting someone new, just gently acknowledging it. And then it's important to keep company with it. Don't try to push it away. Just be with it without judgment. This helps you to realize that you're separate from the feeling, that there's a bigger you that can hold that feeling.
So how do we know when something's actually changing when we're focusing?
That's what we call a felt shift. It's a real feeling of change in your body and mind. It's not just understanding something in your head. It's a change in your experience. Maybe you feel lighter or like something has been unblocked. Gendlin called this a life-forward direction. It's a sign that things are changing in a good way.
Life forward direction. I love that. It really connects to the idea that our bodies naturally want to heal and grow.
I agree. Gendlin believed that our bodies already know the way to healing and growth. And by using focusing, by really listening to our bodies, we can learn what our body already knows and take steps to move forward in our lives.
Okay, so we've talked about what focusing is and why it's important. Now, how do we actually do it? What are the steps?
Well, Gendlin created a 6-step process for focusing that gives us a good way to work with the felt sense. The first step is clearing a space.
Clearing a space. That sounds like getting rid of mental clutter.
In a way, yes. It's about taking time to notice the things that are getting in the way of you feeling good. Maybe pick 3 or 6 things that are on your mind. Then just notice how each of these issues feels in your body, and then imagine putting them aside, somewhere far away from you.
So you're creating distance between yourself and your problems, both in your mind and your body.
Yes, exactly. And once you've set those issues aside, the next part of clearing a space is about getting in touch with what we call the all-fine place. It's like that calm, peaceful place deep inside you that's always there, even when things are difficult. Take a moment to just rest in that feeling of okayness. Sometimes, while you're clearing space, you might notice what we call a background feeling. It's like a feeling that's always there in the background, like anxiety or a low-level sadness. You can gently set that aside too.
It's amazing to think that there's this all fine place inside all of us. What's the next step after we've cleared some space?
The second step is choosing an issue and felt sense. From all those issues that you set aside, or maybe something else that feels really important right now, choose one thing to focus on. The important part here is to then notice how that issue feels in your body, to really get in touch with that whole body feeling, the felt sense.
So you're not just thinking about the problem, you're really feeling it in your body.
The third step is finding a handle symbol. This might be a word, a phrase, a picture in your mind, a gesture, or even a sound that feels connected to that felt sense. It's a way to give it a name or a label. Something really interesting is you can also imagine what it would feel like if the problem was solved, and then find a handle for that feeling of resolution.
That's a great idea. Focusing on how good it would feel to have the problem solved. What happens once you have that handle?
Then we move to the fourth step, resonating. Here, you gently check that handle against the felt sense and see if it really feels right. It's like you're asking yourself, does this handle really match what I'm feeling in my body? You're using your intuition to see if it fits.
Then we go to asking, right? That looks like we're really going to start talking to that felt sense.
Yes. In the asking step, you ask your felt sense questions. Open-ended questions like, what's really at the heart of this?
Yeah.
What would make this feel a little bit better? What's one small step I could take? You're really trying to listen to what your body's trying to tell you.
And the final step is receiving. That sounds like just being open to whatever comes up.
Yes, exactly. Receiving is about just listening to the answers you get from your felt sense, without judging them, just letting the process unfold naturally.
Okay, so now we understand the focusing steps. How does art therapy fit into this?
This is where things get really interesting. Art therapy gives us a whole bunch of tools and materials to express that felt sense without using words. We can draw it, paint it, and sculpt it. It's like a different language for those parts of ourselves that are hard to put into words.
So the art becomes another way to give that felt sense a handle.
Yes, in a way. But it's even deeper than that. Focusing helps us to connect the art we make with what our body is telling us. That felt sense can actually guide us when we make art. It might affect what colors we choose, the shapes we make, even the materials we use. And like you said, we can make an image that symbolizes the felt sense, giving it a physical form.
So it's not just making art and then talking about it. Focusing is part of the whole process.
Exactly. Dr. Rappaport talks about three main ways that focusing and art therapy work together. The first is clearing a space with art.
We talked about clearing a space and focusing. How does art help with that?
So in this way of doing it, we use art materials to actually make those things that are bothering us and then move them away from us. For example, you could draw or sculpt each problem and then physically put that drawing or sculpture somewhere else, away from your workspace. You can also use art to explore that all-fine place, that peaceful place inside. Maybe you could make an image of what that peace feels like to you. And there are a few different ways you could do this, such as non-directive imagery, where the image just kind of comes out without any plan, directive imagery, where you might have an idea or theme to start with, and concrete imagery, which uses more specific instructions. For example, your therapist might ask you to imagine putting your worries into separate boxes or giving them to a trusted person in your artwork. You could even imagine putting them on a little boat and watching it float away. And for non-directive imagery, you might just let your hand draw whatever it wants on the paper without trying to make anything specific. But with directive imagery, your therapist might say something like, draw your anxiety as a storm cloud.
That's really helpful. It's like you're making those difficult feelings real so you can actually see them and move them away from you. But it also makes me think that we need to feel safe when we do this, especially when we're dealing with difficult things from the past.
You're absolutely right. It's really important to adjust how we do this depending on what each person needs. What feels good for one person might be too overwhelming for someone else.
What's the second way focusing and art therapy can be used together?
The second way is focusing-oriented art psychotherapy. This is when we use the focusing steps more directly in therapy while we're making art. The therapist will really listen to you and try to understand how you're feeling, not just from what you say, but from your body language and the art you're creating. It's called experiential listening.
Can you give me an example of how this works?
Sure. In the book, there's a story about Sarah who was going through a lot of changes and was feeling really conflicted inside. She felt this tightness in her chest, and she drew a picture of a heart locked in a box with tears around it. She and her therapist used focusing to really explore this image and how she was feeling in her body. As they did this, Sarah actually started to feel different, lighter. She had a felt shift. Another example is Donna, who felt really depressed and drew a picture of a heavy, sad blob to represent that feeling. By focusing on this image and continuing to make art, she started to understand her depression better. So in this approach, you're always moving between how you feel, the art you make, and what you talk about with your therapist.
Okay, so the art helps you see what you're feeling, and focusing helps you understand it. That makes a lot of sense. And what's the third approach?
The third one is theme-directed. This is where you use art to explore a specific theme in your life. It could be about your relationships, your strengths, or your goals for the future. You make art about this theme and then use focusing to see how that theme feels in your body. It helps you to connect with the theme on a deeper level.
So this one is more structured. You use art as a starting point and then use focusing to see how that art feels in your body.
Yes, that's it. It helps you to look at a specific problem or area in your life in a new way, both by expressing it through art and by feeling it in your body.
This is also interesting. Now, let's see how focusing-oriented art therapy is actually used. Can you give us some real-life examples?
Yes, there are some great examples. One is how it's used to help people manage stress in adult psychiatric day treatment programs. They use a combination of focusing stress check-ins and exercises to help people relax, and they use art to see how these things are working. For example, a client named Adam drew a picture of a hammering pressure to show how stressed he felt. After doing a relaxation exercise, he drew another picture, and this time the picture showed he felt lighter and more open. It's interesting how they adapted the focusing steps for this group. They kept the instructions short and simple and asked clients to keep their eyes open during the focusing exercises.
That makes sense. They changed how they did things to meet the needs of the group. What about other situations?
Another great example is how focusing-oriented art therapy is used in prisons to help inmates heal emotionally and learn to take care of themselves. They have workshops where inmates use art to express themselves and specific techniques like name drawings, where they draw a picture that represents their name and how they feel about themselves. They also do drawings of a higher power or something that gives them spiritual strength. These workshops have been really helpful. The inmates say they feel better about themselves and more connected to others.
Name drawings. That sounds like a really powerful way for people to explore their identity, even if it's in a gentle way.
Yes, and in the prison, a lot of the inmates found that drawing their source of spiritual strength was really helpful for them.
Now, we all have that inner critic, that voice that puts us down.
Yeah,
Does focusing-oriented art therapy have anything to say about how to deal with that?
it does. It gives us some good ways to change how we relate to our inner critic. First, we need to become aware of when the critic is talking, using mindfulness. Then we can use different techniques, including art, to create some space between us and the critic's mean words. And then we can actually use focusing to try and understand the critic. We can be curious about it and even be friendly towards it. We can ask, what is the critic afraid of? What is it trying to protect me from? What does it really want?
Friendly to the inner critic. That's not what I expected.
It might seem strange, but it often works. The book tells the story of Angie, who drew pictures of her critic attacking her, and then drew another picture at how she wished she could relate to that critical part of herself. She even had them talking to each other in the picture. And then there's Janet, who created a critic show to help her step back and see her inner critic in a different way. The important things to remember about the critic are that it's not always right. We can learn to separate ourselves from it. We can try to understand why it's being so mean. And then we can find kinder, gentler ways to handle things.
So instead of fighting against our inner critic, we can try to understand it and maybe even work with it. What about when people from different cultures try to use focusing-oriented art therapy?
That's a really good question. There was a workshop at a focusing conference that used conversation drawing, which is a way of communicating without talking, just through drawing. It brought together people from Japan and North America, and even though they didn't speak the same language, they could connect with each other through art. There was one woman, Takara, who drew a tulip and some stars to represent her felt sense, and then she used the color gray to show how she felt covered over or stuck. This helped her to have a felt shift, a change in how she felt, and she wanted to show her drawing to her partner, Anna. This shows how powerful art can be in helping people from different cultures to understand and connect with each other.
It's amazing how art can help us to understand each other even when we don't speak the same language. I also see here that focusing-oriented art therapy has been used in cancer support groups and for pain management.
Yes. In the cancer support groups, they used a theme-directed approach over 4 weeks. Each week, they focused on a different theme, like clearing a space, finding their source of strength, working on a specific issue, and thinking about what I want to carry with me as I move forward. One of the women in the group, Cindy, had chronic pain, and focusing helped her to notice good feelings in her body, even though she was in pain. She could then use art to remember those good feelings. And for pain management in general, focusing-oriented art therapy can help you to learn to be more accepting of your pain, to use art to create some distance from the pain, and to really listen to what your pain is trying to tell you.
So instead of feeling overwhelmed by pain, you can use focusing and art to understand it better and find some relief. What about using this approach for something like trauma?
When someone has experienced trauma, there's a 3-stage model that can be helpful. The first stage is about feeling safe and stable. The second stage is about remembering and grieving what was lost. And the third stage is about reconnecting with everyday life. Focusing-oriented art therapy can be really useful in each of these stages. Focusing can help you to separate yourself from the trauma, to be kind to the parts of yourself that were hurt, and to connect with your body's natural ability to heal. In the book, there's a story about a woman named Alyssa who used focusing-oriented art therapy to heal from trauma. First, she drew a picture of someone protecting her. Then she worked through feelings of sadness and anger related to the trauma. And finally, she drew a picture representing life, which shows how powerful this process can be in helping people heal.
It's incredible how art can help people express these really difficult feelings and how focusing can guide them through the healing process. The outline also mentions the integration of spirituality. How does that fit in? Spirituality can be a really important part of therapy, and it can be incorporated into focusing-oriented art therapy. For example, you might think about a quote that inspires you, or a time when you felt connected to something bigger than yourself in nature. Then you could use focusing to feel that sense of inspiration in your body. And then you could express those feelings through art. In the book, Patricia used this approach to work through past trauma. She did focusing check-ins and used art to show how she felt and the changes she wanted to make. She also used mindfulness meditation and art to find peace. It's really important that therapists are sensitive to each person's spiritual beliefs and adjust how they use focusing and art to fit those beliefs.
So it's about respecting what the client believes in and using focusing in art in a way that fits with their beliefs. And last but not least, it seems like focusing can be used with other art forms, not just visual art. Yes, definitely. Gendlin talked about working on the avenues, which means understanding that we experience things through different channels like our imagination, our body, and our words. The focusing ideas can be used with other art forms like movement, music, poetry, and drama. For example, in movement therapy, you might use movement to create distance from the issues that are bothering you. This is like the clearing a space step, but using movement instead of art. And there's this idea of intermodal transfer, which means that what you learn and the changes you experience in one art form can affect what happens in another art form. It's an important idea in expressive arts therapy.
This has been so helpful. We've learned so much about focusing-oriented art therapy. What would you say is the most important thing for our listeners to take away from this?
The biggest takeaway is that focusing-oriented art therapy is a really powerful way to get to know yourself better, to understand and work through your emotions, and to heal by combining the wisdom of your body with the power of making art.
So basically, it's learning to listen to that quiet voice inside you, that feeling you get in your body, and then using art to express it and understand it. It's like a more direct path to really understanding yourself and making positive changes.
Yes, that's a great way to put it. By learning to be kind to our feelings and using art to express those feelings, we can learn a lot about ourselves and find ways to feel more whole and well.
That's a perfect summary. And for our listeners, as you go about your day, see if you can notice that felt sense, that knowing in your body. Maybe even try expressing yourself creatively in small ways, like doodling, writing a few lines, or moving your body in response to how you feel. You might be surprised by what you discover about yourself and the challenges you're facing. There are lots of resources out there if you want to learn more about focusing and art therapy. Thanks for joining us for this deep dive.